Hearing loss falls into three different categories: sensorineural hearing loss, which occurs when sound can't get through the inner ear or nerve pathways; conductive hearing loss, which occurs when sound can't get through the outer and/or middle ear; and mixed hearing loss, a conductive hearing loss and a sensorineural hearing loss happening at the same time. Each type has different causes, as well as different interventions. Sensorineural hearing loss is the most common type. This type of hearing loss happens in the cochlea or auditory nerve and is almost always permanent. When a new sensorineural hearing loss develops in children or adults, it is typically because the hair cells inside the cochlea become damaged. When that happens, they can't move like they are supposed to. The most common cause of sensorineural hearing loss is noise exposure, but this damage can also be caused by the infections mentioned earlier: CMV, meningitis, mumps, or measles. Genetic syndromes, such as Pendred, can also cause sensorineural hearing loss to develop and get worse over time. Some other causes of sensorineural hearing loss are head trauma, smoking, chemotherapy or other types of ototoxic medications, noise exposure. Hearing aids or cochlear implants are the most common treatment options for sensorineural hearing loss. Conductive hearing loss occurs when sound cannot travel through the outer and/or middle ear. For instance, if there is fluid buildup in the middle ear or some sort of inflammation that prevents sound waves from traveling in a typical manner. Some common causes of conductive hearing loss include fluid behind the eardrum, middle ear infection, hole in the eardrum, disconnected or broken ossicles, earwax or an object in the ear, eustachian tube dysfunction. Conductive hearing loss can often be corrected through minor procedures or medication. Finally, a mixed hearing loss is when a conductive and sensorineural loss are happening at the same time. Because the two types of hearing loss are happening in different parts of the auditory system, it can dramatically limit the amount of sound that is able to reach the brain. Knowing about these differences can help screeners better understand the different types of hearing screenings and ways that we can help prevent hearing loss when possible.